Now coming to the treatment part. Normally, once we have seen a patient, we know that we have tried best from our side to modify his lifestyle, give him painkillers and provided him rest. If things don't improve, even after all this, then normally we ask for a MRI or a CT scan of the neck and see where the problem is. In majority of the cases, we don't recommend surgery. Lifestyle modification works very well, and it takes care of 99% of the neck problems. In few of the cases where things don't improve even after conservative treatment, physiotherapy for 6 weeks, medicines for 4 weeks, and of course change of profession if required in some of the extreme cases. All these things, if don't work out well in a patient, then only as a surgeon I advise surgery. The surgery can be in the form of taking care of the disc or changing the disc and substituting it with an artificial disc. As you can see here, in young patients where the problem is related to disc and they want to preserve the mobility of the neck, sometimes we advise them this surgery, which is called as disc replacement surgery. In this surgery, through a small incision here from the front of the neck, we take out the disc which is bad and pressing onto the nerve, and we replace it with metal prosthesis which works like a human disc. It takes the pressure off the nerve and at the same time gives mobility to the patient. Second option, which is more advisable for older population, is in which we take out the disc and we don't put a metal prosthesis in its place. We fix the segment from where we take out the disc and just put a plate over it. This way we remove the pressure from the nerve, and at the same time we are able to stabilize the spine by providing it with immediate stability in the form of fixation. Few of the less commonly done procedures which are very effective are when we do a laser surgery or a radio frequency ablation of the joint. Normally, this is a day care procedure and hardly requires 30 minutes of admission, where the patient is asked to lie prone, that is on his stomach, and without any anesthesia, we do burning of these joints selectively. These joints which are the cause of pain, this procedure takes care of the pain generators in the spine and at the same time relieves the patient of the intense pain which he is having. This is a very small procedure, takes hardly 30 minutes. At the end of this procedure, patient is able to walk out of an operation theatre without any pain. Another procedure which we are very commonly doing for cervical spine pain is we are giving blocks. Block is a sort of local medicament that we give, and it takes care of the pain generators. Typically, it is given in conditions where a patient presents to us with pain radiating down the arm. This pain radiating down the arm is because of the chemicals which are released around the spine and which irritate the nerve. Normally, this procedure is also done under local anesthesia, where using a pointed needle, we give small amount of medicines to the point where the nerve exits the foramen. This takes care of the pain going in the arm, also relieves the numbness the patient is suffering from, and in majority of the cases halts the progression of the disease. However, this procedure requires intensive physiotherapy post-procedure, and normally it takes up to 4 to 6 weeks for the pain to completely resolve.